Kukpi7 Tkwamipla7. My English name is Chief Wayne Christian, Chief of the people of Splatsin Health. I wanted to say that what this video really is about is health. And in this time of the pandemic and COVID-19, the virus that's going around and all the things we've been challenged with for almost a year now, health has become really, really important in terms of what we do and how we can do it. The complaints we've received over the years around health is we've been paying attention to those complaints. And the biggest part of it originates from policies and processes that are actually controlled outside of the community. You know, through the First Nations Health Authority. It used to be the First Nations and Inuit Health Branch at one time. Now it's the First Nations Health Authority. So in order to change that dynamic and change the relationship, we had to enter into an MOU, a Memorandum of Understanding with the First Nations Health Authority, to really look at how can we actually plan, design and deliver our own programming that's really specific to Splatsin, specific to our culture, our language, and those things we know that are going to work for our people, so that we're not always fighting against their policy. And so the only way to do that properly is to change the contribution agreement. So we had to enter into a Memorandum of Understanding with the First Nations Health Authority to make that happen. And so we've done some preliminary work. The health staff has been out and engaged the community prior to the pandemic. We started this process and we gathered that information. Now we want to take that information and take it back to you as the community and say, what do you think of these changes? What do you think of what's coming out in terms of what we actually need to do? Because the next stage of this is to actually enter into a different contribution agreement with the First Nations Health Authority. But we need to be clear that we need to be on track with what we want to change. So that's the effort of the health staff over this next little while, is to engage you as community members, as members of Splatsin, as to how you want to see this roll out. It's really, really important that you take this seriously, because it changes the whole dynamic in terms of how we actually have that relationship with the First Nations Health Authority. It becomes more or less of a funder, where they fund us and they tell us what to do, versus a collaborative partnership with us where we can actually design, deliver the services into the community and plan for those services so it's clear. We've been listening to all the complaints over the years and know that we have to change something. And that's the best way to do it, is to change that relationship with the First Nations Health Authority and enter into one that's based on cooperation and collaboration versus one of them, us and them, where they tell us what to do and we spend the money. We're going to change that relationship. So I think it's really important that the health staff is going to be engaging. At this time of COVID, health has become a really big issue. As most of you know, the isolation and what's going on in terms of service delivery, the staff has been really working really diligently hard to work with you to make sure that you're safe. And so I think that's really important why we're doing this and wanting to change the relationship with the First Nations Health Authority. COVID has really exposed how really we're at the mercy of First Nations Health Authority and their policies and procedures, and we are hamstrung by what we can and can't do. And it's very difficult to provide good service to you as members if we can't change that relationship. So again, I thank you for your time. Keep safe. Always remember to look after yourself. You know, wear a mask when you're in public areas and you have to go shopping and those kinds of things. Wash your hands. Look after yourself, especially look after the ones in your family that are vulnerable, the elders. And don't disconnect from people. You can be physically distant, but don't emotionally disconnect. Be connected. And I think it's really important at this time, because the loneliness that people are feeling and the amount of emotions that are going on right now are very real for people. So reach out. You know, you haven't called somebody for a while, call them and speak to them even for 5 to 10 minutes. That pure act of friendship will really lift somebody's spirits, and that's what our people need right now. Your family needs maybe what you need, and it's really important. So that's why this health engagement we're doing around changing the relationship with the First Nations Health Authority is important as we change and move forward in 2021. will carve out a whole different process for how we're actually going to do business with health in our community. So again, I thank you for your time during this Christmas holiday. Look after yourself and enjoy time with your family. Kukpi7.